بسم الله الرحمن الرحيم. إن وزارة الصحة ومن منطلق شفافيتها مع المواطنين الكرام والمجتمع أجمع ووسائل الإعلام تؤكد أنه ومنذ تشخيص أول حالة مصابة بفيروس كورونا النمطي الجديد الذي ينتمي لفصيلة فيروس الكورونا، قامت الوزارة بإطلاع الجميع بكل مهنية وشفافية، واستمرت تبادر بنشر كل الحالات التي يتم تأكيد تشخيصها. ومنذ اكتشاف هذا الفيروس الغامض قامت الوزارة بالتواصل مع الخبراء من داخل وخارج الوطن وبمنظمة الصحة العالمية، ودعت خبراء من جامعة كولومبيا للمشاركة في إجراء مسح ميداني وبيئي للوصول إلى نتائج علمية تساهم في الوقاية من هذا المرض. كما قامت الوزارة بدعوة خبراء متخصصين من كندا وأمريكا ومنظمة الصحة العالمية للاطلاع على كل الإجراءات التي تقوم بها وزارة الصحة، بما في ذلك زيارة المستشفيات والمرضى والاطلاع على ملفاتهم والتواصل مع الكوادر الصحية بكل مهنية. ولقد وصل عدد الحالات المصابة بهذا المرض في المملكة منذ شهر شوال عام 1433 هجري الموافق شهر سبتمبر 2012 ميلادي إلى هذه الساعة 24 حالة، توفي منهم 15 حالة، رحمهم الله وتغمدهم بواسع رحمته، مع عزاء وكافة منسوب الوزارة لذويهم وأسرهم. ومن متابعة الحالات اتضح أن أعراض المرض تتمثل في ارتفاع الحرارة والسعال، يتبعها التهاب رئوي حاد يصيب كلتا الرئتين، ويتم التشخيص بأخذ عينة من سوائل مجرى الجهاز التنفسي. وتبين أن معظم الحالات لديها أمراض مزمنة تؤدي إلى ضعف المناعة لدى المريض. وبدراسة الحالات تبين وجود مؤشرات لانتقال الفيروس لدى المخالطين عن قرب، إلا أن طريقة الانتقال ومصدر الفيروس غير معروفين إلى هذه الساعة، ولا يزال العمل جادا لمزيد من البحث والاستقصاء والدراسة للوصول إلى حقائق مؤكدة تمكن الوزارة من إطلاع المواطنين الكرام والمجتمع أجمع على كل ما يحقق أمنهم وسلامتهم. ونحن متفائلون بإذن الله تعالى، وسوف يستمر التعاون مع منظمة الصحة العالمية وبيوت الخبرة الوطنية والعالمية لما يحقق سلامة وصحة هذا الوطن ومواطنيه الكرام والمجتمع أجمع. ونهيب بالجميع بضرورة اتباع الإرشادات العامة للوقاية من فيروسات الإنفلونزا المتمثلة في النظافة الشخصية وغسل اليدين والابتعاد عن المصابين. وسوف توافيكم وزارة الصحة بأي مستجدات بهذا الخصوص. والسلام عليكم ورحمة الله وبركاته. Maybe you can come closer and read the English.
Good afternoon, everyone, and I would like to thank His Excellency, the Minister of Health, for the invitation for WHO both to work with our colleagues from the Kingdom of Saudi Arabia and also to participate in this press conference. The emergence of this new coronavirus is globally recognized as an important and major challenge for all countries which have been affected, as well as the rest of the world. The Ministry of Health of the Kingdom of Saudi Arabia has recognized this and has invited the World Health Organization to help them assess the situation and to provide guidance and recommendations. WHO is pleased to be here to work together with the Kingdom of Saudi Arabia. At this time, there are things about this new disease we understand. However, I would like to remind everyone that this is a new infection and there are also many gaps in our knowledge, and this inevitably will take time to fill in. We know that this disease is caused by a virus from a group called coronaviruses. One member of this coronavirus family is the SARS virus. This new virus is not the SARS virus. I want to repeat that. This new virus is not the SARS virus. They are distinct from each other. However, the fact that they are related has added to the world's concerns. We know that this new virus has infected people since 2012, but we don't know where the virus lives. We know that when people get infected, many of them develop severe pneumonia. What we don't know is how often people might develop mild disease. We also know that most of the persons who have been infected so far have been older men, often with other medical conditions. We are not sure why we are seeing this pattern and if it will change over time. There are many other things that we don't understand. For example, how are people getting infected? Is it from animals? Is it from contaminated surfaces? Is it from other people? Finally, we don't know how widespread this virus is, both in this region and in other countries outside of this region. The greatest global concern, however, is about the potential for this virus to spread. This is partly because the virus has already caused severe disease in multiple countries, although in small numbers, and has persisted in the region since 2012. Of most concern, however, is the fact that the different clusters seen in multiple countries increasingly support the hypothesis that when there is close contact, this novel coronavirus can transmit from person to person. This pattern of person-to-person transmission has remained limited to small clusters, and so far there is no evidence that this virus has the capacity to sustain generalized community transmission. At this point, several urgent actions are needed. The most important ones are the need for countries, both inside and outside of the region, to increase their levels of awareness among all people, but especially among staff working in their health systems, and to increase their levels of surveillance about this new infection. In Saudi Arabia, we have seen the importance of better surveillance. When new cases are found, as is likely, it is critical for those countries to report these cases and related information urgently to the World Health Organization as required by the international health regulations, because this is the basis for effective international alertness, preparedness, and response. Countries also need to assess their level of preparedness and readiness if this virus should spread, and to intensify strengthening of their core capacities as identified in the international health regulations if the capacities are not adequate. WHO is ready to assist countries in this region and globally in these tasks. There are also some questions that urgently need to be answered, including how are people getting infected, and what are the main risk factors for either infection or development of severe disease. The answers to these questions hold the keys to preventing infection. In closing, we want to note that the government of Saudi Arabia has taken the novel coronavirus situation very seriously. The Ministry of Health has initiated crucial public health actions, including intensifying surveillance, initiating investigations, and initiating important research and putting control measures in place. One of the reasons why more cases have been identified in the Kingdom of Saudi Arabia may be because the Kingdom has gone ahead to strengthen their surveillance system and laboratory capacities and network. Finally, the strong steps taken by Saudi Arabia to protect its people and the experience and knowledge that the country has gained at being at the forefront of fighting this new infection can benefit the rest of the world. Thank you.